Let,
safe.
let's keep it in the KUAM News Zoom room where we're finally starting to catch up here. Guam Department of Education Superintendent Jon Fernandez. Good morning, John.
Good morning, and thank you for squeezing Director Della Sola in between Bill 112 and our education update. I appreciate that.
Oh, man.
Yeah.
Good
I
morning.
think it's also an excellent segue. I heard the job search is going to be required, and we have lots of jobs on our Human Resources Division page on our website. So if anyone out there is interested in, school aid positions and teaching positions, we're looking for a public information officer. Recently retired military. We still have a senior Army instructor for our JROTC programs, educational interpreters. We have a whole bunch of job openings that we still need to fill. So,
Yeah.
This might go hand in hand. We're entering the start of the school year. Go to our GDOE website, look up our human resources page, and there is a link for employment opportunities and status, and take a look and see what you might be interested in. You could even become the new assistant superintendent for special education if that's what interests you and you have the qualifications. So just wanted to tag on to Dave's announcement, and hopefully I think that was a good segue into that.
Do we have that address? John, can you give us the address again, and then Jason can pop it up in the comments? Because
we go to our website is www.gdoe.net, and from there you have to go to the Human Resources division, and then employment opportunities.
Okay, got it.
So
first question, John, how are you going to reopen schools if you need to fill all those positions?
Well, some of these are ongoing announcements, and we always see a turnover in some of these positions. So some people are coming and going, depending on the time of the year. So we always keep a running list of applicants so that we can have them on the list for hire as we go through the school year. So whether it's for substitute teachers or for school age, you never know, based on when you're looking for the job and what's happening during the school year, whether those might come up. So some of these positions are just continuously open so that we can have a list and can get to hiring quickly when we do have a vacancy. It just depends on the position. But with regard to school opening, since our last update, the CDC has released its updated guidelines for the reopening of schools. So I know we talked the last time about, the work that we've been doing with public health to try to get some flexibility, continued flexibility around things like the 3-foot physical distancing requirement, which, for the most part, I think we can handle. But, in some situations that 3 feet becomes, a little constraining depending on the classroom and so forth. So the CDC released its updated guidelines. What they're really promoting, again, is vaccination. So vaccination is really the key strategy, and we, again, are promoting that vaccination those opportunities. Again, we're over 70% of our school-based staff are now fully vaccinated. And as we track the eligible students, we believe that by the start of the school year, the 16 to 19-year-olds will be at around 60%, and the 12 to 15-year-olds will be about 40%. So it'll take a couple more months, to get them fully vaccinated. So we anticipate being able to open fully for 5 days of instruction. Because of our push for vaccination, we will continue those drives, and of course, we do plan to maintain many of the mitigation measures that are in place, including face masking, which I know, has come up when, people are fully vaccinated. The CDC is saying that, well, you can go without a mask, and, but within the school setting where you have so many people together, we anticipate keeping that face mask requirement in place until we get further down the road where, more students are vaccinated, especially knowing that I think Pfizer is out there testing the vaccine for even younger students. So maybe later this year, we'll be able to tackle that part of the population. So with those measures in place, what the CDC is saying is they still recommend the 3-foot distancing, but to the greatest extent possible. But if you can't, meet that in all circumstances, it's very clear not to let that distancing prevent the return to in-person learning. What's really important is having all of the measures, kind of the layered, mitigation measures in place, like we do at DOE. So we're not just doing one or two measures. We've got the face masks, we're putting in the HEPA filters, hand sanitizers, frequent cleaning. The fact that you have several layers of mitigation measures in place makes the physical distancing requirement recommended, but not an absolute, bar to bringing more students, into the classroom. So with that, because public health, their guidance has really tended to mirror the CDC guidance. We're working with public health to see if they will make sure that they update their guidance to reflect the CDC. So I think we're all kind of heading towards that same goal of 5 days of instruction for the coming school year.
And just real quickly, one of the things that we've talked about when it was first discussed about the return of face-to-face, and there was a talk about the screening, and it's also here in the CDC guidelines on screening testing. And so how is that going to work for DOE? Because, some students, they ride the school bus. Are they going to screen them before they get on the bus or when they arrive at the school?
So we're still working on the testing. I mean, the screening. If you're talking about temperature screening,
yes,
we're doing it at the school sites. And so we've equipped all the school sites to do that. And of course, on the buses, the requirement is for the face masking and limited, the limitations on the capacity as really the mitigation measure. We've had some debate about, what putting the temperature scans on the buses and whether that would help or not. But in reality, what you're trying to do is bring the kids on the bus and bring it to school so they can be fully assessed. And if they do have some kind of fever, we can address it at that point. It's really unlikely you're going to be doing that at the bus stop and then preventing a student from getting on the bus. I don't know what we've talked about that. We just think that if you put the distancing measure in place, we put the face masking in place, get them to school, we'll take care of the rest, including if there is an issue, making sure we have contact with parents and guardians so that they can address that. Now, with regard to testing is another aspect of continued, screening for potential positivity, I guess, in the community. We're working with public health right now. There is a grant to support testing on an ongoing basis. And so right now we're just working to design how that might work during the course of the school year. I believe public health is able to access about $5 million to support the testing effort. So they would supply the test kits, and then we would work with public health to develop a screening, more of a proactive, preventative screening approach, so that we're not waiting for cases to be an outbreak, but we're doing it on a regular basis to ensure that we can effectively and proactively assess our community and be able to address things ahead of time if possible. Now, as part of that discussion, we're looking for what type of tests might those be, how, what are the least invasive tests that we might be able to implement, so on and so forth, because, as we're just thinking about the long Q-tips and the kids and trying to get those tests administered. Currently, that might be a challenge, but we are working with public health on a more proactive testing regimen for the coming year. So again, with regard to reopening, when things are looking good in terms of being able to meet the public health requirement, I think the key, of course, is the vaccination strategy, as we mentioned, and then also really, we've been tracking this. We've been tracking the positivity rates and the number of new cases. So I did mention to the Lieutenant Governor, I said, hey, this last week has been a little bit of touch and go, because we're seeing one of the indicators kind of pop up there. And so he's looking into it and really trying to make sure we understand what's happening with the numbers.
Yeah.
Because I think part of the issue might have been, less tests being administered over the past week, and more tests being associated with contact tracing, which might, skew the numbers a little bit. But again, we're monitoring every day. So every time it pops up to a certain level, I'm saying, hey, let me know what's going on here. If there's anything I need to know, so we can, tackle this within the school system. Because whatever's out there in the community is likely going to reflect, in our schools.
Right.
At one point or another. So that's always the likelihood.
John,
and that was something that Chima brought up yesterday, right? With the students that were testing positive and the minors that have been testing positive. They were ineligible to get the vaccine. But the people living in the same household, the adults, are eligible to get the vaccine, but they weren't vaccinated. And so they got COVID and gave it to the children, the minors. And so he was like, could you imagine if these kids, if school was in session? Because
we watch the data the same way you do in terms of the pace of vaccination. And of course, for the under 12-year-olds, we're waiting for that opportunity when there is a vaccine that's been tested and ready to roll out for the younger kids. But for the eligible groups, obviously we've set our goals for 80% or higher. And I know I just talked to the Lieutenant Governor yesterday. We definitely want to continue that progress. But at this point, we really, and I know I see Dr. Hoa coming on, we really want to get an understanding from the doctors and from the folks administering the vaccines, whether what they're seeing in terms of the pace of vaccination. And number two, are we seeing particular pockets of the community that we need to target a little more in terms of outreach and access to the vaccines versus this continuous, open vaccination clinic that we do at UOG? Because we're happy to participate in it, but at this point, it's about targeting those maybe those households that just haven't taken the opportunity and trying to go out and encouraging and making the vaccine accessible for them. So that's part of that continued discussion. But for sure, I think our employees will be at the point where we're going to reach that and surpass the 80%. It's the students that'll take some time, and obviously we're hoping to get there at least by October. But it's going to take a continual push and education campaign to get there.
Do you have any information on uniform vouchers?
I don't have any numbers, except that that's something that we're going to be reaching out because I understand they were supposed to provide information as to how many vouchers would be available. So I don't have that yet, but I do, of course, we do hear from our community asking the same questions, given the fact that the uniform policy has been reinstated for the school year. So we'll be, if I get those numbers, I'll let you know what we're hearing. I haven't heard yet.
John, did we already ask about face masks being available for students who maybe can't afford them or don't have them?
Well, we continue. Yeah, we've used our federal funds to continue to provide those supplies at the school level. So we are planning to continue to supply face masks and other supports to the students and employees at the schools. So that is part of our continued efforts.
We had another comment here. Will there be or is there a policy for particular types of backpacks starting this school year? No changes in the policy. So that's, there aren't any changes in any other policies. I think it was just a uniform that was addressed for the pandemic year. Right. That's now being reinstated. I don't know, Chris and Sabrina. I know we have a little limited time here, but yeah. The other news that came up, and maybe this will be helpful to those families that are trying to juggle their resources as well. We did announce, we didn't announce. USDA announced the approval of our pandemic EBT program. Caught me by surprise because I didn't know that release would come out, but late last week we started getting those inquiries, and so just to let our stakeholders within the GDOE public schools know, because DOE is a National School Lunch Program participant, the pandemic EBT program provides monetary support through basically like a SNAP card to support students who may have missed meals due to the closure of schools over the past school year. So we've gone through the program and applied for it, and it turns out that DODEA is eligible. They're free and reduced students for the time period. I think it was like 42 days that they were closed, and so DODEA will be receiving that benefit. And then GDOE, because we were essentially not back to full operations for the entire school year, all of our students will be eligible for the pandemic EBT program for that period of time. And as I've gone into the details of what that means in terms of benefit, it means up to or between $1,200 to $1,300 per student will be available to those students enrolled in GDOE public schools from August 2020 to May 2021. And I was really surprised because it's, the staff have been working through the details, but they said, hey, from August 20, I think late August to late September, they will be we'll be issuing the cards, in partnership with public health, issuing the cards, and they will be loaded like 4 separate times, but that'll be fully loaded by the end of September. And the total amount is somewhere between $1,200 to $1,300. And those families will have that access to those benefits for the next 365 days before they expire.
Wow.
And these cards, they're separate from the SNAP program, but they're similar in that whatever the SNAP cards are able to purchase in terms of food, you'll be able to use these PEBT cards to do the same. So when once the staff kind of brought me up to speed in terms of exactly what that dollar amount looks like, I started thinking about households with 3, 4, 5 children. I mean, every student gets the same benefit. And I think, we're just glad to see that at least that additional support will be out there as we transition the community towards reopening and recovery from the pandemic. So the only thing I don't have are the details regarding exactly how these cards will be distributed yet. Notification, distribution, it's going to be August to September to complete that process.
John, any news on if private school students will be able to receive this benefit?
These are only for the National School Lunch Program participants. So it really is the DOE, public schools, and DODEA who are participants. So unfortunately, we received that notice. It won't be any private schools or the charter schools unless they are school lunch program participants.
John, I wanted to ask, there was a bill, I think it's before the legislature, relative to teachers in charter schools. Requiring certification. What is it, Bree?
That's basically
it. So basically charter school teachers would be required to be certified just like the GDOE teachers if this bill passes. And I think it's with Senator Shelton, right?
Yeah, I believe she's the one who introduced it.
Right.
Right. Well, we tended to separate ourselves from the conversation because it's a good question because we're all public schools, DOE and charter schools. So we are public schools, and there ought to be public policy discussions regarding what applies to DOE and what applies to the charters. But of course, one of the interesting things that differentiates the traditional public schools from the charters is this 14-point mandate. Where there's 14 points, including the requirement for certified teachers that applies to the traditional public schools and really creates a minimum level of service that we are required to try to meet every year, and which is why we have such a big budget request every year to try to meet that mandate. And through the course of the charter school development of the charter school law, I guess it's been determined that those mandates don't apply to those public schools versus DOE. So, I guess it's a good debate for the legislature to take up. But again, I don't, for us, we know what our mandate is, and it's a tough thing to try to get enough certified teachers to fill our position. So I'm sure the challenges would apply should the charters be included in that mandate.
Very classily put, John. We had a comment here. Did GDOE announce how next test schedule will be in terms of the ABC block schedule by last name, or are students going to be at school all week?
Oh, we're planning for 5 days of instruction for all students who come back. So it's going to be like a regular school, regular school week. And of course, we were hesitating to say that, 100% because we were still working under the previous CDC requirements and trying to get that language to change. But with the updated CDC guidance, and that should take care of the scheduling. It'll be like a normal school year.
Okay. How about busing? Have you guys had those conversations?
We're in the middle of those conversations with DBW to just ensure busing and looking at scheduling and working with Lieutenant Governor. So that'll be another key component. But I think with these latest guidance, I think we've got a set direction, and it's just a matter of nailing down the logistics for the coming school year. So we still have about a month to go, and we'll work out those details prior to the opening.
What about special education students? Are they also returning to face-to-face?
Yeah, we actually prioritized the return of our special education students over the past year, even when we had limited face-to-face. We think that that's the best, way and opportunity to meet the requirements that are under their IEPs by delivering services that would not be available outside of the school setting. So we've been able to accommodate those students over the past school year when we reopened in January to have them come back even multiple days during the week. So we fully anticipate being able to have them back in school, unless we still offer the online option. So if there are students who still, prefer to do that route, then we'll go and support them in that effort. But right now, we still anticipate at least 85% of students all returning back to school.
All right. Very good. No further questions. John?
The only thing I would say is that tomorrow at 2:00, we will be before the legislature, and we will be discussing our FY22 budget request. That budget request was about $373 million when we started out. But of course, the question has been, well, now that you're receiving all these federal funds, do you still need all that money on the local side? So we actually amended our budget request. We took it down to $291 million.
Wow.
Darn it.
Through the federal funds that are made available. So that is different. We revised that budget, but the real key thing is to make sure that the legislature is clear on the requirements for us to continue to access those federal funds, and that's that maintenance of effort requirement. So we hope to clarify, share our calculations with them tomorrow. It looks like, in order for us to meet the maintenance of effort, that the Guam Department of Education, based on the prior, years of funding that we received, ought to be at a minimum receiving 29% of the projected general fund and territorial educational fund revenues that come in. So those are the funds that really that drive our operations. And in FY17 through 19, we received an average of 29%, which is now becomes the baseline for what we should be receiving according to the federal government in order to continue to access the close to 500, close to $500 million, I guess, in funding that is coming our way. So that's an important discussion and important point to make tomorrow. And so we hope the legislature will support us.
That's it's amazing that you're submitting an adjusted budget of 200. Was it? 290 million.
290 is yeah. It was up at 373. We've removed the capital improvement projects. We removed a lot of the instructional supplies and equipment that we can support through the federal funds. We still need to, of course, fund the teachers, fund the utilities, fund some of our basic contracts that were not pandemic related. But at the very least, we just want to make sure we at least meet the minimum requirements so that the federal funds continue to flow, and we don't have to worry about the potential loss of those funds as we look ahead to the next couple of years.
Thank you, John.
Thanks,
All right,
John.
thank you. Have a great week.
We see you too. Quick break, and we're going to come back with Dr. Howell.